Hi everyone, I'm Dr. Afrin Rajai, and today we are going to talk about dialectical behavior therapy. DBT was developed by Marshall Linehan back in 80s, and it's an evidence-based approach, and we are going to talk about how it looks like and the different intervention techniques and more details. But for now, just know that DBT is a kind of approach that when clients they work with it, they need to have this at least 1 year of commitment. Being in therapy, having weekly sessions, and besides the weekly therapy sessions, they need to have skilled group sessions as well. So initially, Marshall Linehan developed DBT in, as I mentioned, 80s for people with suicidal thoughts who also often lived with borderline personality disorder, right? And then, as we know, BPD is a mental health condition that some of its characteristics involves unstable sense of self, intense emotions, impulsive actions, right? Relationship difficulties, and black and white thinking, right? And then because of the fact that we are facing or dealing with these intense emotion and impulsive actions, some of the things that we are going to talk about, like mindfulness and the other skilled groups or skills that we use in DBT, they are really helpful for clients and in working with clients. Actually, DBT is one of the first approaches that use mindfulness, kind of like mindful informed approach. So use mindfulness in sort of psycho-educational ways in working with clients. So DBT is usually used with borderline personality disorder, eating disorders, substance use disorders, and suicidal ideation and self-harm. And all these different disorders, they involve, or conditions, they involve that intense, having intense emotions, impulsive actions, and somehow black and white thinking. Let's pause for a second and talk about dialectic behavior therapy, the term itself. So we have, as you see, DBT here, right? And D is for dialectical. So dialectical here is about the worldview or the manner of persuasion that could bring balance between acceptance and change, right? Before DBT, with the conditions that we were talking about, bipolar personality disorder or self-harm kind of like thoughts, with those conditions, therapists they try to use behavior therapy, right? So, and we learned about that in previous lectures and weeks. And the problem with that, the challenge with that was that with clients and families who experience these intense emotions and impulsive actions, the work was so challenging because as all of us experience, when you want to go through a change process, right, it's not easy, it's difficult, and it's anxiety provoking, right? And then imagine these clients, they are already like experiencing that anxiety, those intense emotions, much more probably much more than what we already experience, like have some experience in our lives maybe, right? So with that, they realized that behavioral therapy was not successful with these clients. And it was so interesting because when we see that something it doesn't work, we just our first reaction is that, so these clients, they do not respond very well, and it's just not, they are not treatable, right? Which is not, of course, like a correct or nice way of thinking. So instead of putting the blame on the clients and saying, hey, this is kind of like because of your situation, this process, it doesn't work, instead of that, we have this option to go and look at the process, what we are doing closely, and see if we can change anything. And DBT is a result of that sort of like thinking and perspective. So people realize that with considering the context of the clients that we are working with, and their condition, and the fact that they are experiencing all these intense emotions and impulsive reactions, this dialectic part, this kind of like worldview and manner of persuasion, that a dialectic is a kind of like a synthesis or integration of opposites, right? So between change and acceptance, maybe we can bring a balance, right? What does that mean? That means that when we work with these clients with the acceptance part, we really try to provide validation. And validation means like accepting who they are, the way they are, right? And with that validation, we kind of like open the door for influence. We kind of like open the door for change. And again, like we don't need to go to extreme examples. I think all of us experience that in our lives, right? That when we talk with that, say friend or family member or therapist, and we felt like we were not judged, like they didn't judge us, like they accepted us as who we are, and they provided validation for our experience. They didn't dismiss our experience, right? Then we felt like we have a better relationship with this person, and we felt like we are now like more open to a change, right? To the change process. The same thing here, like with that balance between acceptance and change and providing validation for clients, we try to open the door for change. And that is all about, dialectic part. Behavior part, as it sounds, it's about changing behaviors, right? So DBT is all about like changing behaviors. So we really, when you are a DBT therapist, you pay close attention to the details of the client's story and problems, and when there's this problem, what happens before the problem, what happens after the problem, what triggers the behavior, and what are the options if you have, when that thing, that event, whatever happens, that trigger happens, then what else like we can do instead of the behavior that we see, which is sometimes problematic in clients' life, right? So when you're a DBT therapist, you really want to pay attention to all of these things, and it's a long process, right? So usually 1 year, and all these steps and all these concepts that you're talking about, they happen throughout this long process. So a lot of times people, they say, if you want to be a DBT therapist, you should just imagine that if you can be a firefighter, if you can be a police officer, right? That kind of like perspective or passion for helping society and clients and people, that kind of passion you should have in DBT, because you're going to work with clients again, like with difficult stories, with intense emotions and behaviors. And because of that, and if we're going to talk about it, that sometimes you need to call clients and to walk them through a specific process that they need to go. And because of all the different techniques and the process and the nature of DBT, if you want to be a DBT therapist, you should really ask yourself, do I see myself being a firefighter or a police officer, right? That kind of like personality or attitude or perspective or just readiness. And if I have that, maybe DBT is a good option for me as a therapist. And this is aligned with what I was just talking about, right? When we say DBT and that dialectic part, it really has to do with this belief that all things, they are like interconnected. They're not really like two opposite things, that they cannot exist together. Maybe they can exist together and they can have a sort of relationship and they can be integrated together, right? And as a DBT therapist, there's this assumption that change is constant and it's always going to be there, no matter if you want it or not. And opposites can be integrated to get closer to the truth, right? Again, like that balance between change and acceptance, and the fact that it is possible to have them together and to have them integrated, and to accept someone as who they are, and at the same time try to help them, or in other words, like push them maybe towards the change, but not too much push, like finding a balance, even like in that pushing, finding a balance in that as well. So DBT therapists, they really believe that clients, they want to get better, they need motivation, and currently they do best they can, right? And because of, again, like the population that we are working with in DBT, they really believe that their life right now is not like heaven. So it's really hard, all the different experiences that they have, and the challenges that they have on a daily basis. It's really hard, and it's sometimes, unbearable for clients, if just we try to just imagine those situations for a second. And because of that, they really need to be helped and motivated, and they cannot fail in counseling. So there's always a way to work with them. You just need to work on the process, right? And we must help them to gain or, achieve these new behaviors. So in DBT, first of all, when you work with clients, you go through or over the consent process, and the consent is for both the client and the therapist, and it's basically a contract about, what you can do, what you can't do, the commitment for being in therapy for, well, usually, at least 1 year, and then no, self-harm, and, all these different things that you can look at in different resources and sources and in articles. Then after that, the process, it has 3 stages, and the way that I usually talk about it is, I would say the first 2 stages is about are about stabilizing clients, and then after that we try to add to the quality of their lives, right? So the first stage is about reducing crisis behaviors and increasing coping skills. This could be about suicide and suicidal thoughts and self-harm. This could be about disruptive behaviors, or things that they do in the counseling process, right? Such as maybe leaving the process, or when they are in a session they start I don't know, yelling, or just, painting dark lines on a wall on a piece of paper, those kinds of things. So whatever that is like disruptive to counseling process. And then this also include interfering with, the behaviors or skills that are interfering with quality of life, or increasing, coping skills, which is again like about like when you feel all these intense emotions, instead of, yelling or harming, punching the wall, harming yourself. These are also the other options that you have and you can practice, right? Then this first stage prepare clients for the second one, which is about reducing trauma-related symptoms. And then once you go over the first stage and the second stage, now clients they are more ready for increasing life-enriching behaviors, right? Then at this stage, you work with clients about how they can have self-validation, how they can validate themselves, their feelings, how they can have respect, trust for themselves, and how they can work on the different goals that they have, just personal goals for their lives. So part of the process or the structure of DBT, it involves all these different forms and categories that you see on this slide. So first of all, of course, that it has one-on-one sessions on a weekly basis. And then besides that, it has group skills training, right? And these 2 options, they are usually like in the contract that we were talking about, like in the beginning when you have that contract before the treatment. Clients, they make the commitment to do both, like be present in one-on-one sessions and also be present in group skills training, right? At least for that 1 year. Then after that, or besides that, we have phone coaching. So when you are a DBT therapist, you have the commitment or kind of like the readiness to be ready for your clients, especially when they are in crisis, to call you, and then you have this phone coaching or consultation with them to walk them through some of the behaviors or things that they can do, and kind of like protecting them from the harm that may happen, or just helping them with some of the life choices that they have in front of themselves. The next thing in the structure of DBT is consultation team, and as we all know, consultation and supervision is always helpful, right? In DBT specifically, because of the population that we are working with, and sometimes it could be just challenging. It could, therapists, they may experience burnout, fatigue very soon, right? This consultation team is just more highlighted, and therapists and DBT therapists, they come together and they consult about cases or their experiences, the experiences that they have in working with a specific client or the population in general, and that is also another aspect or structure of DBT. Probably you can recall that we were just talking about the process of DBT, and we were talking about the 3 stages, right? That the stage 1, stage 2, they're about stabilizing the client and the life that they're experiencing, and also then we have the next stage, stage 3, which is about adding more quality to the life. The goals that we have in DBT, they're aligned with the process, right? So goals include decreasing harm, increasing behavioral skills, and increasing self respect and validation. So when we say decreasing harm, we are talking about decreasing suicidal behaviors, therapy interfering behaviors, behaviors that may reduce the quality of life, right? And when we are talking about increasing behavioral skills, this has to do with kind of like the interventions or techniques that we do in therapy in DBT. But increasing behavioral skills, they include core mindfulness skills, distress tolerance skills, emotion regulation skills, and interpersonal effectiveness skills, right? And then of course that we want to decrease the behaviors that are related to trauma, and then we want to increase self-respect and self-validation in clients. Let's talk about interventions and skills in DBT. As we mentioned in DBT, in group skills that people, the sessions that they have, sometimes they are very psychoeducational about all these different pieces that you see here on this slide: mindfulness, distress tolerance, interpersonal effectiveness, and emotion regulation. So the first thing that is really highlighted in DBT is validation. So as we mentioned, because of that dialectic part, we really want to provide validation for our clients and who they are, and accept them as who they are, right? Kind of like similar to other approaches in therapy. Then some of the interventions or skills that are highlighted in DBT, they include mindfulness, as you see here. So mindfulness, the same thing, like having that notion of having a mindful mind and being mindful of what's going on. So observing, describing, participating, right? Having that non-judgmental kind of like perspective, and thinking about what we are feeling, what we are thinking, what we are seeing right now, how it's affecting our body, kind of like working with clients with that or the different mindfulness skills that we know, right? So for example, one example of that is very common in DBT and in group skills is self-soothe with 6 senses, right? That practice that you ask clients to use their vision, hearing, smell, taste, touch, and movement, right? So look around you and see 5 things in this room, right? And recognize or identify 3 things that you hear, or 3 smell that you sense right now, right? Those kinds of different mindfulness practices and skills that you can work with clients. Then the next one is distress tolerance. So in with this skill, therapists, they really try to kind of like teach clients that pain is part of life, and when you are not mindful of that, when you do not validate the pain, there's more chance that you have intense kind of like emotions or impulsive reactions. But if you accept that pain is part of life, and you accept that we can have or adapt different coping skills when we experience pain, then that would be much better, and then we do not experience these intense emotions, right? Then you work with clients about these different coping skills that they can adapt. Next one is about interpersonal effectiveness, and this could be about communication skills, or different ways that you would add to the quality of your interpersonal relationship. So when you are mindful of what's going on right now, I'm angry, I observe anger, and I am angry because XYZ happened, and I feel the anger in my chest. I feel like my chest is heavy, and I'm going to have deep breath for 30 seconds, and then I'm going to do that self-soothing meditation or mindfulness skill that I learned, and then I'm going to talk about this with my partner or my colleague or friend, right? I'm going to communicate that in a way that is more effective. So right now I'm just experiencing anger, and I need 20 minutes just for myself to make myself calm, right? And then the last one is emotion regulation, which in this one a lot of times they use ABC techniques or other techniques from CBT, which are maybe they modify it in a more dialectic way. So those are the techniques and skills that DBT therapists they use in therapy and in the skills group. DBT has been used with different cultures and populations, and they found that because of that dialectic part, there's so much room for consideration of different beliefs and values of clients, which is aligned with what we want in diversity and culture and having that diverse perspective, right? I think that there's still room for research and study with other populations, because there hasn't been that much study with, for example, in terms of sexuality, there hasn't been that much search and research with DBT. So I think that there is still room for questions and consideration of DBT with different cultures and populations. I found this case study of Annie, and I just wanted to share that with you and include it here. It's a long case study, so I'm not just going to talk about it for 30 minutes, just in sake of keeping the video short. But if you are interested, you can definitely go to this address that I have here on this slide and read this case study of Annie, which is about a client and the process of DBT with this client. And let me know if you have any reflection or questions. Thank you for watching and listening this lecture.